Alright guys, we're going to finish up with question number 14, and that will be the last branch of the trigeminal, and that branch is known as the mandibular nerve. Okay, and first we will begin by saying the basic root of the mandibular nerve. The mandibular nerve, just like all the other branches of the trigeminal, will have to go through the cavernous sinus in order to enter the foramen ovale and exit the cranial cavity, then going into the infratemporal fossa, and it's then going to give off its meningeal branch. Okay, the difference between the mandibular and maxillary, just a small difference, is that the maxillary gives off the meningeal branch before entering its foramen rotundum, whereas the mandibular nerve goes through the foramen ovale and then gives off the meningeal branch. Okay. Now, once the mandibular nerve enters the infratemporal fossa, it's going to give off 5 branches. Now, an acronym to remember this can be used as a LIMB. Okay. So let's talk about the first branch. Okay. Now, guys, like I always do, first we're going to talk about the scheme, and then in the end we're going to identify everything on the Netter's Atlas if we can. So the first branch is going to be A for uricotemporal. The uricotemporal nerve is going to enclose a middle meningeal artery, and the middle meningeal artery is going to be the largest supply to the dura mater. Okay. At the same time, it's also going to give off another meningeal branch. Now, after the uricotemporal has enclosed the middle meningeal artery, it's going to give off 4 different branches that are going to innervate different things. Okay. To be fair, only 3 branches are really going to be innervating something. The first branch is going to be the external acoustic meatus. Okay. The second branch will innervate the skin of the temple, and the third branch will innervate the tympanic membrane. Okay. Now, the fourth branch is a communicating branch. Okay. This communicating branch is important for the anastomosis of the facial and the uricotemporal. Now, why is this anastomosis important? Okay. Well, basically what happens is you have the otic ganglion located in the infratemporal fossa. Okay. Now, in order to see the otic ganglion in the infratemporal fossa, you have to remove, or you have to push away, the uricotemporal nerve. Now, basically what happens is the otic ganglion uses the auriculotemporal nerve and the facial nerve to get to the parotid gland, because the otic ganglion gives off secretory fibers that innervate the parotid gland. Okay, but the otic ganglion cannot get there by itself, so it's going to use a bus system. Okay, so first the otic ganglion is going to, because it's located near the auriculotemporal, it's going to get on the auriculotemporal bus. Now the auriculotemporal bus is going to anastomose with the facial nerve. Therefore, the otic ganglion is going to get on the facial nerve bus, and then the facial nerve, if you guys remember, is going to give off a parotid plexus that divides the parotid gland into a superficial and deep part. Okay, so that is the bus stop, the end bus stop. Okay, just a quick correction. I want to say that the otic ganglion itself is not getting on the bus, of course. Basically, the otic ganglion is sending its postganglionic parasympathetic fibers to the parotid gland. Okay, and the uricotemporal and the facial nerve have the role of helping those parasympathetic fibers get to the parotid gland. Okay, so that was the hard part done. Now, next you have the lingual branch, L for lingual. Okay, and it's going to carry sensory innervation of the anterior 2/3 of the tongue. And then you're going to have your inferior alveolar branch. Now, the inferior alveolar branch is basically going to give off a nerve to the mylohyoid muscle and the anterior belly of digastric before entering the mandibular foramen into the mandibular canal, And once the inferior alveolar is in the mandibular canal, it's going to give off the inferior dental plexus, okay? And after it gives off the inferior dental plexus, it's going to exit the mental foramen and then become the mental nerve. Now this mental nerve is going to innervate the chin, the skin of the mandible, and the lower lip, okay? The fourth branch is going to be your motor mascatory your motor mascatory branch. Now your motor mascatory branch is basically going to innervate your mascatory muscles, which are your medial pterygoid, lateral pterygoid, deep temporal, and masseter. And then the motor mascatory branch is going to give off motor fibers for the tensor tympani and the tensor vela palatini. Now they're basically going to go through the optic ganglion. Okay, so they're going to have these motor fibers for the tensor tympani and the tensor vela palatini are going to go through the optic ganglion and emerge as the tensor tympani nerve and the tensor vela palatini nerve. Okay, and last you have your buccal branch, which is going to pierce the buccinator to innervate the mucosa of the cheeks. Okay, and those are all your branches of the mandibular nerve. Now quickly going to go to page number 45 in the Netter's Atlas, and we're going to point out these branches. Now if you look, okay, in the picture you're going to find this is right here, this is going to be foramen ovale. Mandibular nerve is going to come down, it's going to give off its corresponding motor branches to its masseteric muscles. So your deep temporal, somewhere here should be the masseter. It's going to give off to the medial lateral pterygoid. Okay. Now you see this right here. This is the middle meningeal artery. Okay, this is going to be your middle meningeal artery. Therefore, you know this is the uricotemporal nerve. Okay, the uricotemporal nerve is going to innervate the external acoustic meatus. It's going to give off the. It's going to innervate the tympanic membrane. It's going to innervate the skin of the temple, and also it's going to have a communicating branch with the facial. Okay, now it's been cut here, but this is the facial nerve, and this is supposed to be communicating branch here, but it's been cut off because it's a different view. I'm going to show you that view in a second. Now let's see, what else can we see in this picture? We've talked about the motor branch, we've talked about the uricotemporal, the lingual, I believe, actually, yeah, basically, the lingual is going to go to the submandibular ganglion. That's how we know it's the lingual, okay? And we know that it's a lingual nerve, this lingual nerve, because it's going to be joined by the chordae tympani, okay? Let's see. And when the lingual nerve is basically going to carry the sensory innervation for the anterior 2/3 of the tongue, okay? Let's see. What else do we have? Well, we talked about A-L-I, inferior alveolar. Okay, that's important, but I don't know if we can see it from this view. Well, the inferior alveolar has been cut, but basically it's going to go through, it's going to give a branch to the mylohyoid and the anterior digastric. It's going to go into the mandibular foramen, into the mandibular canal. It's going to travel, and it's going to give off, whilst it's in the mandibular canal, it's going to give off the inferior dental plexus, and then it's going to exit the mental foramen as the mental nerve and innervate the chin, the skin of the mandible, and the lower lip. Okay? Now, just to show you the anastomosis, if you go to page 342 or 343, you can see the let's focus this camera. Okay, so if you see number 20, that's going to be your facial nerve, and number 17. So let me just point this out. Okay, so you have 17. Okay, going all the way up here. Okay, that's going to be your uricotemporal. Okay, That's going to be the first bus for the optic ganglion. Okay, it's going to anastomose with the facial. Okay, and the facial will take it to the parotid gland, where the facial gives off the parotid plexus. Okay, so this is the anastomosis right here. The anastomosis occasionally wraps around the superficial temporal artery of the maxillary artery, and that's the anastomosis for you. So guys, that's your mandibular nerve, and in conclusion, your trigeminal nerve. Try to look at a few different pictures, guys, just so it sticks in your mind. And that's going to be your questions number 12, 13, and 14 done. Okay?